Well, the details and impact of the cuts to the foreign aid budget are only now beginning to emerge. Our health and social care editor, Victoria MacDonald, joins me now. Victoria, what have you managed to uncover?
Well, I've been talking to a health training programme, partnership programme, where NHS staff volunteer their time, go out to lower and middle income countries to share their skills and equally bring back what they've learned to help the NHS. Now, that budget has been completely cut. More than £1 million and more than a year had been spent already on setting up this programme, which had been widely admired by the government and had been much appreciated, was much looked forward to in countries like Myanmar, which we know is in terrible trouble. But the lack of transparency means that they don't know why these cuts have been made. And you have to also say that these are eyes on the world for when there might be another pandemic or epidemic. So they are critical eyes and they're gone.
A coup, COVID and cuts. Myanmar is already a nation in turmoil. Now a doctor who's in hiding has told us that the slashing of the UK's foreign aid budget has come at the worst possible moment.
So since the coup has started, health professionals, all the doctors and nurses are the target of the military coup. They are issued with arrest warrants for treating the injured protesters. Sometimes when they are arrested, they come back not alive but dead. And at the moment, the COVID-19 has been surging and raging back with force. And their testing and the treatment facilities have been stopped. And so nobody actually knows how we are going to tackle this.
£9 million was to have been provided to improve trauma, children's cancer services and nurse training. £7 million of that would have come through the UK Partnerships for Health, a programme set up by the Tropical Health and Education Trust, known as THET, and Liverpool School of Tropical Medicine.
Unfortunately, the expectations have been let down and there will be a huge repercussions from cancelling of this partnership.
This letter to the Prime Minister from MPs and peers asks for the vital support to Myanmar to be continued. They say just a month earlier they had been assured the Health Partnership Programme would not be affected by the cuts. There has been no reply. In all, £48 million is being cut from the global health training budget.
My right honourable friend, the Chancellor, updated the House yesterday on the economic challenges posed by COVID-19. It is a truly sobering assessment.
The official development assistance budget, he said, was to be reduced by £4 billion.
What the government hasn't made clear is where these cuts might fall. In fact, it even refused a freedom of information request to give some detail on the areas or the programmes that could be impacted. Inevitably, though, details are starting to leak out. And the cuts, they are widespread.
Work in Uganda to reduce deaths from sepsis in new mothers. The £300,000 funding has now gone.
We had these huge plans to take things further and really try and improve the outcomes for pregnant women and babies being born in Uganda and try and promote and improve clinical practice there. So we feel we've taken a big step back in what we were able to do, what we were planning to do. And it's going to take quite a lot of time and planning to try and get around that.
Everyone involved in the partnerships has pointed out to us that this aid also benefits the NHS and its staff.
Some work we've done in one of the African countries, developing packages to teach nurses high dependency skills. How do you look after very sick patients? It was developed for work in low-income country. One of the London hospitals took that package to rapidly develop their non-high dependency staff to look after the high dependency COVID patients. The innovations come back to the NHS. It is not one way.
The Foreign, Commonwealth and Development Office said we will still spend more than £10 billion this year to improve global health, fight poverty and tackle climate change. We are working with suppliers and partners on what this means for individual programmes. The UK Partnerships for Health Systems has, however, not yet been contacted by the Foreign Office.